Hi, I'm Dr. Scott Powell. I'm a physician here at Florida E.N.T. and Allergy. And today we want to talk about one of the newer procedures we offer here in the office, Balloon Sinus Dilation. It's a newer procedure. It's been a few years now, but we do it in the office oftentimes because it helps provide the patient an easier path to recovery. It's a procedure that we can do in the office in just under an hour with local numbing medication and avoid all the pitfalls from surgery. Today I want to show you a few different things, how that works, how we go through the procedure, what to expect before, what people can expect, and what people can expect for afterwards. People often ask what exactly is balloon sinus dilation, or often known as balloon sinuplasty. And essentially what happens is we're using your existing openings for your sinuses to allow us to re-dilate them back to a more normal size or just larger than normal size. The beauty of this procedure allows us to use your existing openings to avoid cutting of tissue, which speeds up the recovery and really helps the post-operative or post-procedure ability. So this technology we borrowed this from the heart catheterization world, and essentially what we do is we take a device similar to this, and essentially the first thing that happens once we're numbing the nose is we take a device similar to this, and the tip of this wire oftentimes will actually have an image-guided GPS chip, which allows us to guide it directly into the correct sinus as we work. And then once we're in the correct sinus and things are safely in place, we're able to actually advance this balloon device over that wire into the opening of the sinus. Now once this is in place, again, we're watching this in real time as well as the computer system, we're able to dilate this balloon and without cutting of any tissue, reopen your sinus permanently, and then the balloon deflates and everything gets removed. So the beauty of that is everything gets fixed and opened without anything left behind, instant recovery and gratification. So this is one of our typical procedure rooms, and so what I'm showing you here essentially is the newest technology that we have that we're able to essentially GPS locate the sinuses as we safely enter them to dilate. So what this view is showing us is all the different planes of the sinuses and then a 3D reconstruction that again allows us to essentially watch the wire go into the sinus as if we're standing in the sinus. This is a very impressive technology which is less than a few months or a year old. And so essentially as this wire does advance into the sinus, we are able to watch it go into the sinus as if we're sitting in your sinus watching it come in, or outside the sinus watching it go out, whichever we would prefer. This allows for immense safety and confirmation of location of the balloon all in real time. A question I'm often asked is which patients are legitimately eligible for this procedure. Criteria met for balloon sinus dilation. And there's two main groups. The traditional chronic sinus patients work well with this procedure, and they can work well for traditional sinus surgery or the balloon. And the balloon procedure is nice because again, it reduces the risk and reduces the recovery. The other group are those recurrent acutes, and those are the patients who actually get better with antibiotics, better with steroids, and they have periods where they're doing pretty well. But it's often like a roller coaster, where they get better, they get worse, they get better, they get worse. And so what we're doing with this procedure is we're truncating that phenomenon, giving them a reset button so we can start over and get them better. And then we pivot over towards the medical management. So the criteria for this procedure oftentimes is chronic sinus infections or recurrent acute sinus infections. Now sinus infections, when they become chronic, often have a different symptom set. It can be congestion, it can be facial pressure, but oftentimes when you get in the chronic realm, it is postnasal drainage, it can be fatigue, change in smell, mucus, drainage, other nasal symptoms and systemic symptoms that oftentimes will lead to the chronic sinus diagnosis. When we see the patients in the office, we're able to determine this based off our examination, and then from there determine whether or not the patient is a candidate for this procedure going forward. When we see a patient in the office and determine whether or not they are a candidate for any procedure, including the balloon sinus dilation, there are certain things we do in the office. Oftentimes we'll take a small little camera and examine their nose and sinuses to verify their symptoms correlate with infection or chronic infection. We're also able to, here in the office, perform an in-office CAT scan, which offers lower radiation, which helps us prove and verify that the sinus infection is the cause as well as blockage. And it's nice that we're able to go in real time, go over with the patient right then and there. From there, based off of that and the history of multiple medications and problems, we're able to piece this together and move forward with the balloon sinus dilation procedure. This is one of our traditional procedure rooms, and as you can see, we have all we really need here. The patient would sit here. We're able to in real time visualize the sinuses as we would in the operating room with cameras and telescopic lenses, but also we're able to see in 3D view in real time as we enter the sinuses with the device. So with all this and the patient resting comfortably here, we're able to get everything done comfortably without using needles, with only topical numbing. The patient's very happy, they leave happy, they're able to drive home afterwards. So as you can see, the recovery is very quick, approximately 12 to 24 hours. And the change or difference from the traditional sinus surgery. So traditional sinus surgery, rather than using a device to enter the natural opening and gently dilate that opening to make it permanent, with traditional sinus surgery, we actually cut away tissue to make those openings larger. Now, anytime the body has any cuts or surgery, it wants to try to scar closed. And so what we have to do during the recovery phase is continually see the patient in the office and clear out those crusts and scars so that it heals in an open position. So that is, unfortunately, an additional time period for recovery, and that can take a few weeks. While traditionally we do not pack the nose either way, that is something that delays the recovery from 12 to 24 hours to a couple, 3 weeks in terms of multiple office visits. Balloon sinus dilation or balloon sinuplasty is very successfully done in the office. It is very safe for multiple reasons. One, we're using non-rigid instruments to enter your sinus openings that already exist. Number two, there's multiple tools on the instrument that allow for security, either a lighted light wire or more importantly now, GPS guided light wire to enter the sinus while we're directly looking at it as well. So that really increases the safety of this factor. The risks are minimal. The recovery is quick. Roughly the procedure takes about 1 hour, and then that same day patients do take some ibuprofen or some Tylenol and do some irrigations for their nose, and they're back to normal activities usually the next day. Well, the procedure itself takes about an hour and the recovery is approximately 24 hours. The benefits from the surgery last beyond 2 years. And the studies have shown at 2 years where the study stopped that the effects are equal to traditional sinus surgery as they are for the balloon procedure. So therefore, it does not typically need to be repeatedly done. However, in some cases, if after surgery or procedure, we do need to address the medical reasons for this, whether that's allergy, inflammation, or otherwise, to maintain that benefit. Sometimes the most important question we get is, how does it feel? Is there pain? Does it hurt? And the answer to that question essentially is, the patients are extremely numbed with topical medication. We avoid use of needles. However, afterwards and during the procedure, when the balloon does inflate, oftentimes there's a few seconds of pressure. That pressure goes away when the balloon deflates and they go back to the normal state. And as mentioned, oftentimes ibuprofen or Tylenol is all that is needed for the procedure. Very well tolerated for all ages. I want to thank you for taking the time to watch these videos, and I hope they were very informative for you to determine whether or not this procedure might be good for you. Feel free to call our office, and we're happy to help going forward, to help you with this procedure and any problems you might have. Florida ENT and Allergy. Breathe well, hear well, be well.